Unraveling the secrets of mycoses, prevention, symptoms, and treatments. Welcome! Did you know that millions of people around the world suffer from a fairly common nuisance? We're talking about ringworm. Whether skin, nail, or scalp ringworm, these fungal infections can cause discomfort, itching, and even affect self-esteem. But don't worry, because today we are here to help. In this video, we will unravel the secrets of mycoses. Let's explore everything you need to know about prevention, symptoms, and effective treatments. So I ask that you take a few minutes of your time and stay until the end, because we have valuable information to share. Throughout this video, we will address the different types of mycoses, the warning signs to be observed, practical tips to prevent the spread of these infections, and the best treatments available. If you've ever had or know someone who suffers from ringworm, this is the right place to find answers. Remember, information is power. And understanding more about mycoses is the first step to prevention and proper treatment. So let's embark on this journey together and figure out how to deal with mycoses effectively. Now, hit play and let's start this fascinating exploration of mycoses. What is ringworm? Ringworm is an infection caused by fungi that affects the skin, nails, and hair. Fungi that cause mycoses are microscopic organisms present in the environment and can proliferate in humid and warm areas of the body. There are several types of mycoses, each affecting a specific region of the body. Mycoses can occur in different parts of the body, such as the skin ringworm, nails, onychomycosis, scalp, Tinea capitis, groin, Tinea cruris, feet, athlete's foot, among others. Symptoms of ringworm vary according to the type of ringworm and the affected region, but usually include redness and irritation on the skin, intense itching, peeling of the skin, presence of lesions, blisters or rashes, changes in the appearance of nails, such as thickening, discoloration and detachment. There are several types of mycosis, for example, ringworm, Tinea corporis, also known as Tinea corporis. It is a fungal infection that affects the surface of the skin, causing reddish spots with raised edges and flaking. Onychomycosis, nail mycosis. It is a fungal infection that affects the toenails and/or hands. Affected nails can become thick, discolored, brittle, and may detach from the skin. Tinea pedis, athlete's foot. It is a fungal infection that affects the feet, especially the area between the fingers. It can cause severe itching, redness, peeling, cracks in the skin, and unpleasant odor. Tinea cruris, crotch ringworm, also known as groin itch or jock itch. It is a fungal infection that affects the groin region. It causes severe itching, redness, peeling, and irritation in the groin, thighs, and buttocks. Tinea capitis, ringworm of the scalp. It is a fungal infection that affects the scalp and hair follicles. It can cause hair loss in circular areas, flaking, itching, and crusting on the scalp. Candidiasis, see genital mycosis. It is an infection caused by the fungus Candida, which can affect both men and women. In women, it can cause vaginal infection, vulvovaginitis, with discharge, itching, and redness. In men, it can affect the glands of the penis, causing redness, itching, and burning sensation. These are just a few examples of the most common mycoses. There are other types of mycoses that can affect specific areas of the body, such as the face, hands, and genitals. In case of suspected ringworm, it is important to seek medical advice for a correct diagnosis and an appropriate treatment plan. Complications of mycosis. Mycoses, when not treated properly or in more severe cases, can lead to some complications. Although most fungal infections are relatively benign, some complications may occur, including secondary infections. Areas affected by mycoses may be more susceptible to secondary bacterial infections. This is because the skin weakened and damaged by fungal infection can make way for the entry of bacteria. Spread of infection. In more severe cases, mycoses can spread beyond the initially affected area. This can occur when the infection is not treated properly, the immune system is weakened, or personal hygiene measures are not followed. Nail complications. Onychomycosis, nail mycosis, can lead to complications such as permanent deformation of the nail, increased fragility, and greater susceptibility to bacterial infections. Systemic infections. Although rare, in people with weakened immune systems, such as those with HIV/AIDS or in cancer treatment, fungi can cause more severe infections that spread to internal organs. These systemic fungal infections may be life-threatening and require immediate medical treatment. Psychosocial complications. Depending on the location and severity of the fungal infection, affected people may experience physical discomfort, severe itching, pain, and even embarrassment or social isolation. How to avoid mycoses. To prevent mycosis, it is important to adopt specific hygiene and care measures. Here are some tips that can help prevent fungal infections. Keep skin clean and dry. Regularly wash skin with water and mild soap. Make sure to dry wet areas thoroughly, especially between the toes, groin, and armpits. Avoid humid environments. Fungi tend to proliferate in hot and humid environments. Avoid wearing wet clothes for too long and avoid wearing closed shoes for too long, especially if your feet sweat too much. Wear airy shoes and cotton socks. Do not share personal items. Avoid sharing towels, clothes, shoes, hairbrushes, or other personal items, as this can contribute to the spread of fungi. Wear slippers in public places. When attending swimming pools, saunas, public bathrooms, or dressing rooms, wear slippers or sandals to avoid direct contact with the floor, which may be contaminated with fungi. Keep your toenails short and clean. Keep your toenails properly cut and clean. Avoid biting your nails or removing the cuticle, as this can create wounds that facilitate the entry of fungi. Avoid direct contact with infected animals. Some animals, such as cats and dogs, can transmit certain types of mycoses. Avoid direct contact with infected animals or take appropriate precautions when dealing with them. Caution when using public pools and saunas. Check that the pools and saunas you frequent have good hygiene and proper maintenance. Avoid using these facilities if they look dirty or improperly cared for. Keep your immune system healthy. Good overall health and a strong immune system can help prevent fungal infections. Maintain a balanced diet, exercise regularly, get enough sleep, and manage stress. Treatment for mycosis. There are different types of treatments for ringworm, depending on the type and location of the fungal infection. Here are some of the main treatments used. Topical treatment. Topical treatment involves applying antifungal drugs directly to the affected area. This can include creams, lotions, sprays, solutions, or ointments. These drugs help fight the fungus and relieve symptoms. It is important to follow the instructions for use and apply the drug as prescribed by the doctor. Oral treatment. In more severe cases or when the infection is more widespread, the use of oral antifungal drugs may be necessary. These drugs are taken orally, in the form of tablets or capsules, and act to combat the fungus from the inside out, through the bloodstream. Oral treatment is usually prescribed for nail infections, scalp infections, or systemic infections. Treatment for nail mycosis. Onychomycosis, fungal nail infection, may be more difficult to treat. In addition to topical or oral medications, specific treatments such as antifungal enamels, infected nail removers, or surgical removal procedures of the affected nail in severe cases may be used. Laser therapy. In some cases, laser therapy may be a treatment option for certain types of mycosis, such as onychomycosis. The laser is directed to the affected area, helping to destroy the fungus present on the nails or skin. It is important to note that proper treatment should be determined by a health professional, such as a dermatologist. Each case is unique and treatment may vary based on the severity, extent of infection, and medical history of the patient. It is essential to follow the medical instructions and complete the treatment to the end, even if the symptoms disappear, to ensure complete elimination of the fungus and avoid recurrences. We have reached the end of this mycoses video. We hope the information shared has been helpful and enlightening to you. Remember that if you suspect a fungal infection or are experiencing mycosis-related problems, it is critical to seek the advice of a healthcare professional, such as a doctor or dermatologist. Now that you are more informed, about prevention, symptoms, and treatments, you are more prepared, to deal with mycoses effectively. Don't forget to apply the preventative measures we mentioned throughout the video and take care of your overall health to keep your immune system strong. If this video was useful to you, don't forget to like it, share it with others, and subscribe to our channel to receive more health and wellness information. Thank you for watching and taking the time to learn more about mycoses. Keep taking care of yourself, and until next time.